I understand you're involved in some exponential technology as well in the medical field. What can you tell us about that?
Well, I chair a conference each year out of Singularity University called Exponential Medicine, where we actually look at the fast-moving pace of technology and how we can use that in health and medicine, everything from wellness and prevention to doing a better job of diagnosis and therapy. And I can sort of show you a couple of slides here indicative of the fact that many technologies are moving very quickly today, and they're often writing Moore's law. That's the computation in our smartphones, for example, that are 1 billion times better than the best supercomputers at MIT in the 70s. And it's not just Moore's law that's moving quickly, it's many fields. And it's when we understand this exponential thinking, the power of doubling every 6 to 12 months, that the opportunity to have disruption occurs. And we can maybe then rethink how healthcare has been performed. It's not actually healthcare, it's been sick care. We often focus on when disease has already happened.
Is the biggest change in healthcare information technology, the ability to gather information, or is it more of the wet stuff, the molecules and atoms and cells?
I think we're merging now this idea of sort of digital medicine, along with this explosion of, for example, our own personal genomics. We're at the point today where the price of sequencing your genome has dropped from $1 million 10 or 12 years ago to about $1,000 today. It's dropped at twice the rate of Moore's law. We're in the age now of wearable devices that for just a few dollars can track your steps and your sleep and your activity. And it's the blending of those elements, your genomic information, your wearable device information, environmental, the exposome, even your microbiome, the bugs in our GI tract, that when we pull all that together, we have the opportunity to shift healthcare from where it's sort of been, which is very reactive. We wait for the heart attack or the stroke or the lump to be discovered, and the data is very intermittent. Once in a while you get a blood pressure check or a blood test, and move it to an era which is much more continuous and proactive. So proactive, because you might know your genetic information, and then continuous, because we now have a whole new set of tools, often connected to our smartphones, that can give us a digital checkup anywhere.
Are we talking about making lifestyle changes to avoid illness?
Well, that's where we can make the most impact, right? A lot of disease is impacted not by our genetics, but by our behaviors. And if you can shift your understanding of your risk profile, for example, I have about twice the genetic risk of developing type 2 diabetes, I kind of have shifted my diet a little bit. If you know you have a risk for Alzheimer's disease, for example, you may want to start brain training exercises or other elements that might improve your mental health. So it's a blend of those sensibilities, and I think the future of medicine is one where you, as a consumer, as a patient, you really own your data. You own your own health. We already go to Dr. Google more than our regular doctors, and the more you can be engaged and understand where you are from the risk profile to how you might manage diagnosis and therapy, the better we can be individually and as a society.
What are some of the most difficult problems to solve in medicine today, the real bottlenecks to progress?
Well, a lot of them are sort of the feedback loops. I'm a physician. I've done lots of primary care. I might prescribe you exercise or a drug or a blood pressure medicine, but traditionally the data I would get back from you is very fragmented. If you're a diabetic, you might scribble your numbers and fax it to me once a month. Today we're in this era now where you can walk into an Apple store, a Best Buy, and there's 30 connected health devices on the shelf. I brought a few with me today as sort of examples of that.
I understand that you're wearing such a device right now.
Well, I'm wearing sort of basic fitness trackers, which are starting to disappear into our, let's say, the Apple Watch, which was just announced. I'm also wearing a $2 disposable patch from a local company called Vital Connect. And this little patch I'm wearing underneath my shirt, and it's actually talking to my smartphone. And right now on my phone, I can see my live data, my EKG, my step activity. And this is not only on my phone, it's...
Okay, can we hold it up so that...
I'm going to show you live on my phone, but if we go right to the web page here, this is streaming from my phone to the web, and you can see that my heart rate's 84. I'm breathing about 18 breaths a minute. You can see my stress levels, only 74%. Thank you very much.
So we're not being too hard on you on the show.
Only 75%. I've got 25% to go. Okay, it's shown okay. You can see how many steps I've done over the last month or so, my temperature, my posture. This is a lot of data coming to me from a disposable patch. Now, will your doctor want to have all this data? What are they going to do with this big data era? Part of what we're going to need to layer on top of this information is things like artificial intelligence, which companies like IBM with IBM Watson are starting to play in healthcare, so that you're not just having reams of data, it becomes actionable information. It'll help me do a better job of doing diagnosis for you, or when you have the diagnosis, picking the right medicine. It might be based on your genetics, or by your activity, or by your blood pressure that's collected at home on devices like this.
Do you look forward to a time when we'll be able to cure everything, or do you think people will always have diseases, they'll always have illnesses, that's just part of being alive?
Well, I think most of us are interested not just in longevity, sort of lifespan. We want health span. And I think with some of these technologies, we can avoid some of these scourges on society, whether it's diabetes, heart disease, stroke, cancer. I'm trained as an oncologist at Stanford, and many cancers we detect late. That's when they're expensive and often impossible to cure. We're starting to find this era of, let's say, blood-based biopsies, where with a single drop of blood, you can look at 10,000 biomarkers and find out when you're starting to go off kilter. So we might, in some ways, start to cure the well before they get sick. And we'll start to see, in your home today, you might have a thermometer, maybe a blood pressure cuff. We're entering the era of sort of medical tricorders. This is a technology developed by one of the companies developed and spun out of my FutureMed program. This is a medical tricorder device called the Scanner Scout. If I hold this to my forehead, it talks to my smartphone, records my temperature, my heart rate, my oxygen saturation, my stress level, and it will blend with IBM Watson type technology to do a better job of saying, hey, Daniel, you're a little out of normal range. It could communicate that to my doctor, or if I was in trouble, maybe even call 911.
So can it diagnose actual ailments, or just say, well, your heart rate is a little bit high or a little too low?
Well, as physicians, we like to take data and integrate that with the clinical story. So with the X Prize to make a medical tricorder, the teams competing in that competition are aiming to do a better job of diagnosing the 16 most common disorders, pneumonia, heart disease, even cancer, at home, better than a panel of board-certified physicians. And because many physicians have different levels of training, different levels of experience, when we start to blend, big data, artificial intelligence, sensors, the Internet of Things, I think we'll end up with an era where, together with your physician, together with Watson and mobile, we'll do a better, faster job of diagnosis and therapy.
Now, do you bring this into Singularity University as head of the medical track there? Do you impart all this to the students there so that they get a grounding in what is possible with modern sensors and modern electronics, and then try to leave it to them to figure out how to apply the technology?
Well, part one is understanding, where technology is today. How do you have a convergence of technology? This, right, for example, is many technologies packed into a little pill that I can swallow. It has a camera, and it can replace an upper endoscopy, right? That's many technologies coming together. Or 3D printing, which is moving very quickly. This is what I call Mini-Me. This is made on a pretty low-cost 3D printer. I was scanned with a Microsoft Kinect. This has applications in healthcare as well, for orthopedic devices and beyond. So as a student, if you understand, wow, this is where 3D printing is, where genomics is going to be in a couple of years is a $100 genome or a $10 genome, you can start to sort of invent and put together solutions to address some of these grand challenges, whether it's obesity, diabetes, malaria, cancer, and beyond.
It sounds like a lot of it could be applied to underdeveloped countries as well, because we have great medicine in this country, but it's extremely expensive, and the rest of the world can't afford it. But if we can reduce the price, then almost anybody could get it.
Absolutely. A lot of expensive technologies are disappearing. Like, for example, a GPS device. Most of us wouldn't buy a GPS device for our car today. It's a free app on our smartphones. And things like low-cost tablets, this is actually a $35 tablet being sold in India today for $35. It's not the fastest Samsung Galaxy. In a few years, it will be. This can democratize education and healthcare, and together with some of these sensors and connectivity and telemedicine, you could be in a rural village in India or a rural town in Idaho and have access to some of the best minds, technology, and infrastructure to do a better job of prevention, diagnosis, and therapy.
Now, technology is changing the world very rapidly. Is there such a thing as changing the world too rapidly, destabilizing the world with the pace of change?
Well, there's often a dark side, right? Personal genomics. I might be able to sequence you from your glass there and publish that on the web. You might not be happy if we published your genetic risk factors. Or someone might hack into your pacemaker, for example, if you had one, and get you into trouble. So there's always a bit of a slippery slope with lots of technologies, and sometimes the policies and the ethics are outpaced by the speed of technology itself. But I think on general, if we can shift some of our regulatory processes, like our FDA often doesn't keep up with the pace of change, or the payers, the insurers, how do they reward and pay for an app? There are apps now that can help me manage a patient's diabetes and do that in a much better way than the old-fashioned methods. Who's going to pay for and regulate those apps? So sometimes the technology moves faster, and we need to think about where the puck is going, as Wayne Gretzky says, in an exponential manner.
Now, Singularity University seems to be very interested in medical work. In fact, among all the startup companies, a lot of them are concerned with medical issues. In our next roll-in, we're going to talk to some of the people in some of those companies. Let's go ahead and roll that tape.